What's up, everybody? Today we're joined by a chiropractor that flew all the way from Cardiff, Wales. If you don't know what Cardiff, Wales is, either did I. Just kidding. But it's the United Kingdom, and so he's here. He actually saw us adjust on YouTube. And can you tell the good people a little bit more about what you saw and what got you to come over here?
So I saw Dr. Brett on YouTube, and there's a few things that draw me towards him, but the big thing was how he treats the patients in the flow and his present time consciousness, really focusing him on what needs to be done. And after that, I got in contact with him, and I thought, you know, I've got to get out over here and see this guy and learn from the best.
And so what have you thought so far? You got to observe yesterday, and you're about to observe again this afternoon, and what'd you think yesterday?
Big thing for me was seeing the patients and how much time you were spending with them and the focus and the energy on each patient. Mm-hmm. And there was nothing that was waving your energy away from them. It was the 100% focus and giving the most of the adjustment.
It's beautiful. And a little bit about your practice, because you're in Cardiff and it's called?
The Tuning Room Chiropractic, and we're based in Cardiff in Wales, yep. In the UK.
In the UK, not England.
Not England.
Which is not the perfect name for a chiropractic practice, the Tuning Room. I love it. I would steal it if it wasn't already taken, but it's taken. All right, so we're gonna go ahead and get them adjusted. All right, go ahead and lay it on down here. Yeah, I was surprised because Dr. Tom reached out to me and he said, hey, I'm gonna be in Oakland. Is it cool if I come shadow, hang out at your practice? And I said, absolutely. But I didn't know that he was coming out here for that. So I was like, yeah, just blown away, feeling honored and humbled to be able to receive that honor. All right, so we're gonna check him out today. Right now I'm picking up more tension in the Achilles on the right side. Let's go ahead, do a little scan here of their upper back. And so for those of you that have been watching some of my videos, what you'll notice is it's not a lot of segmental motion palpation. It's typically more of a scan. Now, the scan is like a slide of the hands, and why you would do a scan versus like the segmental palpation is because it's more of a tonal approach. So we're looking for dissonance in tone, which you could say of the fascia, of the muscles, and really of the skin, of the energy, of everything from the deepest layer working its way out, and seeing where there's potential dissonance or disharmony in the scan. And so for Tom, in that scan, I pick it up right here. And so that is an area of potential. Now, once I've discovered the area that I want to go ahead and focus on, then that's where I need to get the characteristics of the joint, confirm that if I am gonna put an osseous application in, that it is fixated, stuck, or dysfunctional, because we don't wanna adjust hypermobile joints. We wanna adjust the ones that are not moving properly. But I use the scan to kind of help discover what we could say where the juice is, where the potential is. And so for Tom, it's right here. We're about the T9, T10 level. There is a rotation superiorward on the left side. So we're gonna take that out with counter-clockwise rotation. Go and take a nice breath in, Tom. Let it out. So then we're rotating down, then sinking body in, right there. And that was perfect. And we'll come back and recheck the feet. When we first started, the right Achilles was tight. So already you're getting a little more balance in the feet. The feet are even. Let's go ahead and check them when we bring the feet with knee flexion. And just checking to see actually the quality motion of the pelvis. So the ilium should be rotating from a neutral position, more anteriorward, and the sacrum usually follows with that. Osteokinematically and arthrokinematically, and we're seeing what's happening with the ilium and sacrum motion as we glide up. And now what I'm noticing is as I glide up, there is a slight fixation point at about that's about 110 degrees of knee bend, more on the right side. So I'll follow up and sink in with direct palpation, seeing if I can get more characteristics of what that subluxation pattern is. And for Dr. Tom, I'm picking up, mainly it's like a P-R sacrum, and it's closer to the S3 tubercle. So going more midway down the sacrum. Go this side up for me and face me this way. I think another thing that drew Dr. Tom in was he said the speed, that he's attracted to the speed component, and one of your first seminars, somebody was talking about the speed component as well, right? Or just recently anyway. Right there. So we're getting that connection. So for him, it's a rotation this way. It starts to open up. And then I'm seeing how much nutation or counter nutation. So right there, letting it open, right there, rising. Got it. On your back. See, and I actually adjusted them yesterday as well. It was a similar listing, but I did it involve side down because it wasn't ready to open the other side. But today it did, so the system's already adapting, already evolving and changing as it should. So continued care, which we haven't talked a lot about on this channel, is when you use more of a tonal approach, every time you check the system, you want to check it as it's brand new. So it's a new encounter, meaning that historically, a lot of chiropractors have established a set of listings that they're going to adjust you in. So meaning you had a rotated ilium a certain way, a rotated thoracic a certain way, a rotated cervical a certain way, and then we have certain classifications of those listings. And then you could even have like a listing card, right? And so what would happen is you break somebody from their stuck dysfunctional pattern, but then over time, adapt them into a new stuck pattern. And so within tonal and under the advice of Dr. Marvin Talski, what he's bringing to the table is that ultimately you should avoid adjusting the same thing the same way 3 times in a row to avoid putting somebody into a new stuck pattern. And so what that means for us is that every time we approach the spine, we may be aware of certain listings that they had in the past, but ultimately we try to approach it from a blank slate or a blank canvas and then let artistry start to flow. All right, so checking his neck here, again, it's more of a tonal check, and then we work our way to the actual biomechanics of the spine. Picking up C5 on C6, posterior facet dysfunction just on one side, and then I sink in to confirm. And so since that is just, we also want to do the one side, the adjustive impulse will come more through in this direction instead of going through to clear both facets. We just want to clear just this one on the right side. So we're right here, and that one came through and off, and that style of adjustment is something I learned from a Dr. Tim Young, who practices in Oklahoma City, also leads a seminar group called Focus. So for those chiropractors out there that have never seen Dr. Tim Young adjust, I recommend checking him out. We did an artistry showcase on him with Kairos Training Culture, and it turned out beautiful. And actually what I'll do is I'll upload it to the YouTube channel so you guys can check it out too, because I think you're gonna enjoy it. All right, and then for here, this is gonna be really light. It's C2 and C3, but it's not heavily stuck, so now we can modify how much impulse we wanna put in. And see, it looked a lot different than it did on the other side. So it's one thing to be able to generate big speed and big power. The other piece is to know how to modulate it for that person at that time. So we'll come back, recheck. So we're checking here, but then I'm also checking to see how the whole system is able to redistribute impulse or input, and system's feeling clear. You're all set, brother. Yeah, man. So go ahead and tell the people, how was your adjustment?
The speed and the specificity of those adjustments is just clears the system straight away. Even before that last cervical on the left, I could feel the tension was there. It didn't need much. It was just enough speed, just clear the tension.
So giving the system exactly what it needs when it needs it.
Exactly.
That's beautiful. Now, how will you take what you've learned from being here back home to Wales?
So the biggest take home, I think, is going to be the specificity of the adjustment at the right time to that person, to that system, with the amount of speed and energy that is required.
Absolutely. Yeah. That's it. He just said it all. And what he's talking about is the Kairos. And so for those of you that are unaware, we do have another company called Kairos Training Culture, and it's chiropractor basically development training. And Kairos is the perfect moment, the perfect time where an impulse must be delivered for success to be achieved. That's the chiropractic adjustment. And so it's being there, being present, being in present time consciousness, and delivering what needs to be delivered when it needs to be delivered, what we call with that special something, and that's the Kairos. So brother, such a great pleasure and honor having you here. Thank you for making the trip, and thank you for contributing to people learning about chiropractic and what we do.
Thank you.
Cool.